But yeah, I'm Dr. Jessica Garrett, and I'm really excited to be presenting again with you guys today. I will give you a heads up. I am super sick, so I'm just hoping to get through this presentation right now. But yeah, today I am talking on using ozone therapy in congestive heart failure, which is a little bit of a new subject to me. So I'm excited to share with you guys what I've been learning and hope that this helps some of you and your patients. So just to kind of cover that quick intro, like Jonathan was already saying, yeah, I graduated from Purdue, definitely did not learn any ozone therapy there. And I'm disappointed that it's not something that is being taught more actively in the US, but I'm hoping that over time we can change that. I was actually introduced to ozone therapy in 2017 during my clinical year externship. I was with a vet in Ohio that I had gone to him mostly because I was interested in learning some of the chiropractic and acupuncture that he was using. And then he introduced me to ozone, and I just was immediately impressed with everything that I was seeing. Brought it back with me to school, trying to talk about stuff. And of course, they weren't interested in talking about it. But I was lucky enough to find a job when I was starting off with Dr. Marty Langhofer, who practices near where I grew up. And he was a great mentor because he had really started getting into the ozone therapy as well. And it was really wonderful getting to start my career with him and have that mentorship. I was able to go get the certification through the Schallenberger Institute and did the O3 vets, of course. And through all of that, continued building my knowledge and exploring things on my own, just finding different ways to utilize this really impressive tool that we have. And then in 2022, I opened Garrett Veterinary Services with my husband. We really liked the idea of being able to practice together, being able to have a little bit of control over our schedules as we were raising our family. And ozone therapy has been a really big part of our practice. So I'm excited to share with you a little bit of what we've learned. A few disclaimers. I am not a cardiologist, definitely not even close. But being a general practice veterinarian, I do see a fair amount of heart disease. With this lecture today, I am going to say I definitely have limited case numbers because we've only just started using ozone therapy for heart failure patients very recently. But I will share with you a little bit about the one patient that got me interested in using it in this way. Another thing to consider is that there's actually very limited research available on the veterinary side of this. When I was trying to do research for this presentation, I was disappointed to find that there really wasn't much available for the vet side, but there was plenty available on the human side, actually, mostly from other countries. As other presenters have stated, we don't see as much of this happening in the US as we should, but definitely really substantial evidence of how beneficial ozone can be for our heart failure patients. So just to get kind of the general idea of how prevalent heart disease is, as most of you who are in general practice are going to know, it's something that we see very routinely, sometimes every day, at least every week. You're seeing some patient with a heart murmur and likely moving into congestive heart failure. It's estimated in the US that 10% of dogs seen by general practitioners have heart disease of some sort. And then in the senior dogs, that number is much higher, just being that it's more prevalent there, with 75% of senior dogs having heart disease. And it's also worth noting that 15% of cats have hypertrophic cardiomyopathy. Many of those will go undiagnosed for a long time because they don't necessarily have the murmur every time, and they don't always have the symptoms that you expect to see. So it's just worth remembering that this is a big part of general practice. And I think having something that can help such a large group in our practices can be really beneficial. So some of the things that we see with congestive heart failure, of course, we see the pulmonary edema. And from that, We see poor oxygenation, not just from the pulmonary edema, also from other factors of heart disease, just affecting the flow of the blood and how easily the blood cells are letting go of that oxygen and getting into those tissues and perfusion and everything. There's also the increased risk of thrombus just because of the turbulent blood flow through the heart. And then we start seeing those fluid shifts where you start seeing some of the third spacing, get the effusion built up in different places, or edema in the limbs, things like that. And ultimately, as things go on, it's one of the leading causes of suffering in our patients as they progress to death, is essentially drowning in your own body. So we wanted to find ways that we can help to improve the quality of life. We know even with all of the treatments from cardiologists, and certainly same with ozone, we're not going to be able to reverse heart failure. We're not going to be able to take it away, but we can help the patients to manage it and have a better quality of life for a longer period of time. So this is the patient that got me started using ozone therapy for heart failure. And I'm sure none of you are surprised to see her breed. She is a Cavalier King Charles Spaniel, the poster child for mitral valve disease. She came to us already long since diagnosed. She's got a grade 6 out of 6 left systolic heart murmur, confirmed mitral valve disease. She was already in left-sided heart failure and was progressing to the decompensated right-sided heart failure. And we initially were not even seeing her for any ozone-related things, but we were seeing her sister, owned by her owner's daughter, who had brought her sister into us to be treated with ozone therapy for lymphoma. And while she was there, this owner had really started getting into ozone therapy. She was interested in being able to do some treatments at home. And she said, hey, you know, my mom's dog that you see has heart failure. Would there be anything wrong with me treating her with rectal ozone at home? And I said, well, you know, it's certainly not going to hurt. It's going to help with the oxygenation, and I don't see a reason not to try it. And I offered, since we were already going to be having the other one come in for the major autohemotherapy, I offered for Emma to come along and try a treatment for herself. And we were really just excited to see the results that we were seeing. So the owner, the owner's daughter, the owner of the other dog, purchased a hummingbird machine from O3 Vets and started doing rectal ozone 3 to 4 days a week at home. And I had her kind of ranging in the 15 to 25 micrograms per milliliter, doing 1 mil per pound. And then we were doing the major autohemotherapy. We started twice the first week. And then after that, we went down to once weekly. And even after just the first treatment, there was a significant improvement for Emma. The owner noted significant improvement in the energy and attitude. She was running and playing, acting like a puppy, which she hadn't done in a long time. She was back to, you know, barking at the neighbors and just having a good time, seeming like she was wanting to interact with her sister. Her breathing was significantly improved as well. They felt like even with the medications that she had been on, she always struggled a little bit. And she got to the point where the coughing had almost disappeared. They really didn't notice the increased respiratory rate or increased effort. And they were really happy with the results they were seeing. So they did decide to go ahead and continue weekly for quite a while. They did feel that overall it improved her quality of life. And they had already had discussions about whether or not to euthanize this dog. And with this, they've been able to really prolong that time that they have together. They did try for a little bit to decrease the frequency of doing the major autohemotherapy. And we're just getting back to it. We did do another treatment recently because they felt that she was starting to have a lot more of the ascites just more frequently. We've been doing therapeutic abdominocentesis, and it seemed that when we slowed down on the ozone therapy, that maybe increased a little bit. And so we're trying to add the ozone back in, and it does seem that her energy level has already improved once again, which I'm sure none of you are surprised after hearing some of these other lectures today, just with that overall feeling that it helps them to feel better. It releases some of those good endorphins, and also is, of course, helping with the oxygenation. So to get a little bit into the science of how it all works, as we know, we get that increased production of ATP, getting that energy to the cells and helping all the cells to do their own jobs better. We get that increase in the 2,3-DPG, which helps to improve the oxygenation of the tissues by helping the blood cells to let go of that oxygen when it gets where it needs to be. And then we see the creation of super gifted erythrocytes as well. We also see activation of nitric oxide synthase, and we see an improvement in the blood cell membrane elasticity when we get that increased negative charge on the membrane surface, which I found really interesting with the flexibility of the blood cells and how that can impact things, just as far as how they get out into the capillaries, how we see less of the blood cell destruction. And it also helps to have a controlled anticoagulant effect with that, which helps with that thrombus formation as well. So with that, you see, again, the reduced blood viscosity, and we get an increase in the arterial oxygen partial pressure and a reduced venous oxygen partial pressure. So again, just helping with all of that oxygen exchange, which is so important for all of our tissues as we just live life. The oxidative stress, I know we've touched on in several other lectures as well. So just to briefly go through that, we do see that modulation of oxidative stress. It creates that preconditioning effect and helps to balance the redox system. And it's important as we are going through this that what we are administering with the ozone is not going to exceed the body's antioxidant capacity. You need to make sure we're using appropriate doses and concentrations, because there's that concept of too much of a good thing can be a bad thing. You need to have that balance there, but by being able to induce that antioxidant state and help to support the body, we see a lot of improvement as we go through clearing toxins and just how the impact on all of our organs and down to the cellular level. When we look at the endothelium, that is something that we need to be thinking about for our vascular diseases and everything. We see the induction of the synthesis of nitric oxide, and the ozone also will help with transendothelial migration of the leukocytes. So that helps when we're trying to heal our tissues. Those leukocytes are able to get out and clean up the messes. And we also see an increase in the fibroblasts and remodeling of those endothelial cells, which can help as far as the microcirculation in the body, which is so important for things like vasculitis and tissue oxygenation and all of that. So like I said, when I was looking into this a little bit more to prepare for this presentation, I really didn't have a lot of studies available to me as far as the veterinary side of things. There was something that was using rat models that, of course, was still targeted for human studies, but everything else that I was finding was all on the human side, which I'm glad that they are using ozone therapy for human heart disease. And so what I'm pulling together here is all from human studies, but I think that it's important to remember that this all can still be applied to our veterinary patients. So the one study that I found very interesting was specifically looking at human athletes. And if you know much about sports and such, it's very common to send these athletes to train in higher altitudes because that helps to increase the 2,3-DPG to basically make them more efficient at oxygenating their tissues and such. And it can also increase the red blood cells and everything. So in this, they were essentially trying to mimic that effect with ozone. And by treating with a series of major autohemotherapy, they did see a 10% increase across the board with 2,3-DPG, which shows just how effective this can be at improving the tissue oxygenation and the body's efficiency of that oxygen exchange. There were a lot of studies that followed along this same kind of pathway and showed consistent improvement in dyspnea scores. The 6-minute walk test, which is not something we do as far as I know in veterinary medicine, but essentially is an exercise tolerance test, which we have our own ways of doing that. And the patients reported an overall improvement in their comfort levels. So I think that's definitely something that can be translated to our animal patients. Another study that I found interesting in 2021, there was a study with human patients. Most of the studies are studying patients that have what they call class 2 to 3 congestive heart failure. And this one, they specifically made sure that they all had left ventricular ejection fraction of less than 50%. And they all had to have an elevated proBNP as one of the primary markers in the blood for checking for heart disease. This study used rectal insufflation rather than the MAH, and I thought that was interesting as well. They were seeing improvement with only using rectal insufflation. Just goes to show how impressive that modality is for your systemic treatment. So with that, we saw they did increasing concentration over a series of 20 sessions. They would increase the dose every 5 sessions in this particular study. And they ranged from 25 micrograms per mil up to 40 micrograms per mil. And they were doing a 300 mil volume in your average size human. What this study found was reduction of the proBNP values by 50%, which I think is wildly impressive, as we see that evidence in that biomarker of the improvement using the ozone. And they also saw an increase in the ejection fraction from the left ventricle, which is incredible that we're not only seeing the improvement with the blood biomarkers, but we're also seeing that evidence on the echocardiogram. And I think that's really great because it is something that you can't argue against. You can say, absolutely, did the ozone improve not only the oxygenation, but also the function of the heart? And here we see absolutely it did. Another study in 2017 took 40 human patients with the class 2 and 3 congestive heart failure and 40 non-congestive heart failure patients. And they treated all of these with MAH over the course of 5 weeks. And this one tested several different biomarkers. They were seeing increase in the superoxide dismutase, the catalase, glutathione peroxidase, significant reduction of the proBNP once again. And they felt there was moderate improvement in the 6-minute walk test as far as you're looking at that exercise tolerance, and significant reduction in the, this one was using the echo to check left ventricular and diastolic volume and left ventricular and systolic volume. And they saw reduction in those volumes, meaning that the heart is more efficient at pumping that blood out of the chambers. With that, you get reduced risk of thrombus and, of course, just better circulation. So I know others have talked about dosages today, and it does seem that there's variability in the recommendation of dosages out there depending on which source you're using. But it's important to remember the principle of hormesis and ozone therapy, where low doses will show high efficacy, but as we increase those doses, the higher it gets, we sometimes get to the point where we have reduced efficacy and, of course, the progression to toxicity. So we just want to make sure that we are utilizing the studies that are out there and the recommended dosages. What I had found through different programs that I have done for training, as well as papers that have been published, it looks like you have a range for systemic use anywhere from 10 to 40 micrograms per mil. And that is, whether you're doing IV or rectal. There has been certainly some discussion and evidence for rectal insufflation staying at 25 micrograms per mil or lower, as some are finding that anything above 25 micrograms per mil can have some negative effects on just the mucosal lining there. So something to keep in mind. I usually keep my rectal ozone around the 25 micrograms per mil. And I do go toward the higher end when I'm doing IV. Usually I start on the lower end and I progress that up depending on their tolerance for it. As far as topical use, which isn't really applicable to this lecture here, you definitely can go much higher. That 60 to 100 micrograms per mil has been proven for direct antibacterial effect. You just certainly wouldn't have reason to use that for congestive heart failure cases right now. When treating congestive heart failure, what I have done thus far has been primarily the major autohemotherapy. I think certainly an argument can be made that there may be enough effect with the rectal ozone that we may not need the MAH in all of our patients. Certainly based on that one study that I shared, that has been shown on the human side to show significant improvement. For me, when I'm doing MAH, I place the IV catheter and I draw 1 to 2 mils per 10 pounds of body weight into a heparinized syringe or a blood bag that has anticoagulant. Seeing some of the lectures today, I may actually increase the amount of blood that we're treating because it does seem that others are doing more. This is just what I was trained to do, and it has been effective for us. But I'm curious, I may end up increasing that blood volume. And then what I do is usually add double the volume of the blood as far as ozonated saline. And then I mix that with ozone gas, usually around 20 to 30 micrograms per mil. And once that's well mixed, I expel any of the remaining gas and then reinfuse the liquid through an IV catheter blood filter and give that back to the patient. I hope the colors show up well on your screen here, but I thought this was just a really good, interesting visualization of the oxygenation of the blood as we add that ozone. So you can see the picture on the left is a fresh blood draw. This was actually from Emma, the patient I shared with you. This was not from her first treatment. Her first treatment, her blood was so poorly oxygenated, it actually took multiple rounds of adding ozone gas to it before we got the color change. Now we get that color change right away when we're doing it, which I think is great. But yeah, you can see how dark that blood is with the fresh blood draw. And then it gets a bit brighter when we add the ozonated saline. And then the picture all the way on the right, having the ozone gas added in, you can see how bright and rich that color is, just showing that oxygenation of the blood cells. As you are choosing your patients to start with, right now, I'm really not seeing a reason that we shouldn't offer it to every heart failure patient. I think I'm going to start having that discussion with a lot of my pet owners at the first signs of congestive heart failure, as this is something that can help to improve your dog's quality of life and improve how that heart is functioning to give you longer with your dog. I certainly would consider even starting major autohemotherapy or rectal ozone just periodically if we're seeing elevated pro-BNP, even if the patient's not clinical. At our clinic, we've started checking pro-BNP with our annual blood work, and that is allowing us to kind of get serial tracking of that. So if we see that number going up, it's worth having that discussion with the owner that this might be something that could help and benefit your patient. You also have to consider the individual and what that patient is going to tolerate, because like I talked about the dog at the beginning, her sister that we were originally treating for the lymphoma, we had to change our plan for her because she became much less tolerant of getting poked all the time with needles. So she's now getting primarily the rectal ozone and just periodically getting the MAH. And so you have to look at your individual patient. Are they going to tolerate getting an IV catheter put in every week? Or is this going to be something that we just do when they seem to be feeling at their lowest and otherwise manage with the rectal ozone? And you also have to consider what the owner can handle financially, because if you're managing the heart disease well, there are a lot of these patients that can go on for several months and even years after a diagnosis. And there are a lot of owners that are not going to be able to handle coming into the clinic every week or even doing treatments on their own at home all the time. So having that discussion is definitely a good place to start. I felt that it's important, no matter what we're talking about, to also identify potential risk factors. But frankly, I had a hard time finding a whole lot of risk for our heart disease patients. I did want to go ahead and share a couple of studies. There was one that was studying inhaled environmental ozone, more so from industrial ozone machines, that did find evidence of platelet activation and an increase in the blood pressure. They studied a 24-hour exposure, and then they studied a longer-term 2-week exposure for ones that the levels were low enough to not be causing obvious lung function changes. And they did feel in that study that they were finding evidence of potential damage to the heart. That was the only study like that I found, and I have to question, if it is potentially causing damage there, why are we seeing so much improvement with the other studies? But I did feel it was worthwhile to include that just so that we're having that discussion. And there was another case report from 2015. It was a single case report, and I cannot find any others so far that had similar findings. But this case report was at least suspecting that ozone had caused a myocardial infarction in a patient. He had no other known risk factors for heart disease and had been treated with MAH that morning and presented with the acute inferior myocardial infarction just hours later. So they do suspect that ozone was the cause, but reading the study, the case report, they really didn't have significant evidence other than the fact that that was the only thing that had changed in that man's day. Of course, keeping in mind that we have the risk of, if we're inhaling ozone at too high a concentration, you can get the non-cardiogenic pulmonary edema. But that is just something that we need to make sure that we're using the right modality. We're generally not having our patients breathe straight ozone gas. If we're doing anything respiratory, we're having them inhale things through the saline or the glycerin or the oil. So I don't think that that's something that I would consider a risk factor in treating heart disease if we're using this appropriately. This whole subject has gotten me interested in other areas, other ways that we can utilize ozone in veterinary medicine, specifically having to do with our cardio patients. I think something that would be interesting to look into would be the effects for peripheral vasculitis. Think your little dachshunds with the ear tip vasculitis, or some of the collies that get the really awful vasculitis for their toenails. I do think it'd be interesting to see how much of an impact the ozone can have for that, because what we've seen from these studies with the improvement in tissue oxygenation, the improvement in the elasticity of the blood cells, showing that we can actually push more of that blood safely through those capillaries and get better blood flow to those areas, better perfusion. I think that it has a lot of potential. And if anybody out there is using it for vasculitis, I would love to just hear your results. I think that'd be really interesting. Thrombotic conditions as well, since we have seen this controlled anticoagulant effect, I think that it's very likely that our patients with thrombotic conditions would be benefiting from the ozone as well. I also think athletic recovery is an area that we can expand into, thinking about those that have injuries, of course, but also those that just have excessive strain from, racing or eventing or things like that. And then performance enhancement. Could we use this prior to those events to prevent the athletic injuries and to improve their endurance for these things? Could this ever potentially be used to pre-treat racehorses or endurance horses or jumpers? I don't know that you'd ever get it past any of the racing boards, but I do think it could be a really interesting study, since we have seen that improvement in the human athletes, showing that improvement in the 2,3 DPG. I think this could be a really interesting area to expand into. So I think as we are going forward and closing out here, it's important just for you to start asking yourself, how can I implement this for my patients with heart disease? am I going to start offering rectal ozone weekly or something like that for the ones that are starting to show symptoms of congestive heart failure? I really do think that we should be considering offering this at the first signs, though I know not everybody's going to go for it. I think I want to start having that conversation with more of my patients, and I'm excited to let you guys know next year how that goes. So I am interested, like I said, in expanding some of the research. I think it's really important that we get some of this research on the veterinary side. So if you have interesting cases to discuss or data that you've collected, please feel free to email it to me. I've got my email address there. And I would really be interested in collaborating on that, because I think that we can do a lot more of the research on the veterinary side to support what we're doing. And then I think that closes us out to go for any questions.
All right. I'm going to turn that one off. Okay, great. Well, thank you. Can you hear me okay?
Yeah.
Great.
Yeah, I can hear you.
You made it.
Yeah.
I'm going to start a poll real quick here. So see who is currently already using Ozone for heart failure versus maybe those who are not. But one quick question that I had to start is just so primarily it's rectal insufflation and major autohemotherapy have been the two administration routes that you've used so far. When you do major autohemotherapy, are you doing it with ultraviolet UV or just by itself?
I haven't for this. I wouldn't be opposed to it, but at least in my understanding of it, the ultraviolet we're using more often for like the infection side of things, like the UVC is so beneficial for the viruses and such. But I would certainly be willing to try that if there's reason to think that it would be more beneficial than the MAH.
And kind of along with that question, do you use minor autohemotherapy at all when you're doing the MAH or no?
I haven't for the heart patients. I have found the minor autohemotherapy useful for some of the immune conditions, but it's not the treatment that I use the most, I would say. I really have only used that a handful of times.
Okay. I asked because there was a company that did a lot of chronic heart failure type of studies where they treated humans on the human side. Well, they did animal studies, like you said, targeted towards humans, but with rats. And they used kind of like that minor autohemotherapy administration route with O3 UV irradiated blood. And so yeah,
well, I'd love to look into that. But yeah, I have not personally used the minor autohemotherapy.
Yeah, I don't think it's necessarily just that's not a no-brainer. That's just something that there was a particular technology they were using where that's what the treatment was. And it was slightly different than what we do. But okay, so it looks like about a third of those who are here are actually using it in some capacity for heart failure. So
that's great.
Yeah. So here's a couple of questions. What are you charging for your rectal ozone and IV treatments? There's one question.
Yeah. So for I might actually have to look it up. For the major autohemotherapy, I want to say it's about $150. And we probably should be charging more, but we're still a fairly new practice, and we were trying to really, we decreased the prices on a lot of our ozone therapies compared to what I had charged when I was working for somebody else, because we were trying to invite more of those in. So I want to say it's probably around $150 for that. And then the rectal ozone, I think, is about $30.
Okay.
For charging. And for that patient, the owner just found it better to buy her own machine. And I encourage the ones that are going to be doing that for long-term use to just get their own machine. We did have someone that rented out. We have a hummingbird unit that will rent out to owners. And we had somebody that did rent that for a while. I think we were charging her like $50 a week for that. And she was able to do several treatments at home per week.
Great. You may or may not know this, But in the 2021 study using rectal ozone only, did they treat daily? It said they did 20 sessions.
Yeah,
Yeah.
I saw that question pop up, and I wish that I remembered because I know I
Yeah.
read that study a
Yeah.
few weeks ago. I think that one they did every day for the 20 sessions, but I'm now that I'm kind of thinking back, I'm wondering if it was some of them were every day, some of them might have been more spread out, and that's why they called it
Yeah.
20 sessions because it was however long it took for that person to do 20 sessions. I know on the veterinary side, what we had learned through O3 Vets also was that it's somewhat beneficial to give a break. So I usually don't have somebody do something every day. A lot of times, if we're doing treatments, I'll let them do like 5 days on, 2 days off, or doing 3 to 4 times a week, rather than doing every single day, just to kind of give the body a chance to reboot from that and kind of calm down. But on the human side, it does seem that they do a lot of the daily treatments for longer periods of time.
So is there any rhyme or reason to when you use major versus rectal MAH?
Personally, I have felt that the major, you get a stronger response and a faster response. And so I will use that for maybe the more severe cases. But the rectal ozone really is pretty impressive in and of itself. And it's a fairly inexpensive way to go about it. So certainly that's something that I offer in those financial cases is, if there's only one thing that you can do the rectal ozone for sure.
Okay. So, here's a question about using ozone, maybe nebulizing ozone into an oxy cage with congestive heart failure alongside of or instead.
Yeah, I have not tried that, but I definitely think it would be good. I just, since I started using it, haven't had a reason to have anybody in an oxygen cage. But I certainly would not be opposed to it, making sure that, you're doing it at a concentration that's going to be safe for them to inhale, doing it through the proper medium, whether that's the oils or something like that. But I think it could be beneficial. I certainly would do it for any where we're talking about, a non-cardiogenic pulmonary issue where we're worried about infection. I think nebulization would be definitely a top line treatment, but I think it would be beneficial potentially for our heart patients as well.
Okay, great. So Dr. McCorkle was curious about the studies and whether or not she could get those. I know you put your email on the screen, so I know she could probably contact you directly.
Yeah. You could probably, if you want to email me, if you have questions about those, I can send some of those out. I normally include a slide at the end of the lectures that has all of those sources, and I didn't this time, but I could pretty easily pull those and send them to you. But they were all things that I was able to find through going on Google Scholar and, sources like PubMed and all of
great.
that.
Can you expand on the treatment of peripheral vasculitis and Dachshunds with ozone?
Well, that's what I'm wondering if somebody has done that, because I haven't personally used it yet. Other than I did have one patient that I had them using the topical ozone oil, but I was primarily doing that for where it had already broken open. We were essentially treating the marginal wounds that were there, and it was really helpful for that. I don't know if it was also improving the blood flow, but at this point, I'm kind of assuming that it may have. But certainly if I have that situation come up again, I'm probably going to be recommending we at least do rectal ozone just to get that systemic absorption and see if we can improve the blood flow to those areas. But if anybody out there has done it, I'd love to hear about it to see, how that's worked for you.
Dr. Fisher Kenny asked, did you come across any info or studies on ozone for the use of endocarditis?
I didn't, but I wasn't specifically looking for that. But I would suspect that we would see definitely improvement with that as well. Because of course we're seeing the improvement in the function of the heart as far as those ejection volumes and everything, or the ejection fractions. But also we know, especially this is a bacterial endocarditis, we know that the ozone therapy is going to help the body to fight off those infections. So I do think that we would see some improvement with that. But I didn't specifically look for any studies. They might be out there. I just wasn't looking.
Last one. So do you monitor the patient? Have you seen any complications with your patients?
I have not for, dealing with the heart patients, but I had seen things in the past when, another vet was working with a cat and maybe administered too high a concentration too quickly. And that cat did have a moment of like agonal breathing, and it kind of freaked us all out. And so we slowed down on her. I have heard of things like that happening. It seems to be more often with cats that we see a little bit more of a reaction. So I usually start cats at a lower concentration, and I just make sure when I'm doing the MAH that I'm pushing slowly, and I watch the patients for things like nausea, because you definitely can see some of that as like a more mild side effect. And if I start seeing like the lip smacking and such, I just slow down how quickly I'm pushing it a bit. But usually it's very well tolerated. I don't tend to have issues as far as how the patients are doing.
Awesome.